Okay, so from the perspective of climate change and health, and I'm, there's basically, for me, the most critical element of solutions-based journalism is to drive emotional connection with people. People will not want to create change unless they have an emotional connection with the subject matter. And it doesn't always have to be your own personal struggle. It can be where something is written in such a way that it allows you to form an emotional connection with the stories that are being told. And in order to achieve that, you have to tell the stories of human beings. You have to tell people's stories. Other statistics have power, but you have to color the statistics. I would say the statistics are like the outline, and the human stories are the colors that you color in the outline with. And so, for example, when you're talking about climate change and health, I would suggest, in my humble opinion, that you tell the stories of those who are on the front lines of climate change driven health problems, those who are the most vulnerable people. So, in terms of the stories that I write, those people are, for example, would be small farmers, and how, as a result of climate change, their crops are not as nutritious. They don't produce enough. So, from the perspective of crops not being as nutritious, that of course affects the health within the community. But also, if you're not producing as much output, that means that countries have to import more foods. And then you have a greater incidence of non communicable diseases. And you can talk about how, for example, let's give an example in the case of Jamaica. Um, a large push in Jamaica is to provide healthy foods within schools. Ideally, you'd want to get foods from small farmers within the community so that you can support those small farmers. But due to climate change, you're getting more severe um, weather events. You're not getting as large an output. The food is not as nutritious, and food is not coming in. Local fresh food is not coming into the schools as much as possible. This is one of the contributors to the fact that we have some of the highest obesity rates in the world, that we have some of the highest rates of non-communicable diseases in the world within this region, because we're so overly dependent on imported foods. And much of that is driven by our vulnerability to climate change effects. So you almost have to connect the dots to the source of the problem. And the way of doing that is by connecting human stories.
Wonderful, thank you. Um, so the last piece, perhaps, around mental health. So similar question: how what are special issues around mental health and mental illness that reporters should be thinking about as they try to drive towards solutions journalism?
For me, I believe that the biggest issue with driving change in mental health as a journalist is to overcome the stigma around mental health issues. And that is achieved through storytelling, by bringing in groups who typically would not be associated with mental health issues. So let's not look at, you know, the poor mother with, you know, the poor single mother with lots of mouths to feed, which is absolutely a relevant story. But let's try and go for some unlikely stories. And I guess in the case of the article that you would have read, it was teen stories around mental health. That is a really important issue because teenagers are so afraid of what others think. I think as we get older, we get more comfortable within our skin and are more willing to talk about our struggle. With three teenagers out there, I can tell you they get embarrassed by everything. And when you're able to connect with the vulnerability of others who look and act like you, who are the same age as you, and same gender as you, even, you feel more empowered to have a voice. So in this instance, I interviewed a few teenagers to create some relatability. It's also useful to parents because oftentimes the person who is most embarrassed or is the driver of the stigma is a parent. And then to provide options and answers, and also to talk about how did we get here in the first place. So, for example, part of the reason that the stigma exists is that, I mean, there are a few things. One of them is the lack of access to mental health care, from the perspective of financial support, from lack of access within schools. And as a result, ignorance gets perpetuated because people don't have anywhere to reach. So they kind of deny that the problem exists. And so problems are perpetuated within society. I think we have to tell the stories of those who are most affected by the problems, tell the unlikely stories of people who are being affected, and also speak to people who are helping to solve those problems within communities. Because that's also something that isn't done. Oftentimes people are telling the talking about the problem, but aren't talking about people who are at the front lines driving solutions.
That's very powerful to remind folks of in terms of solutions journalism is to, at the end, here's where you can turn and here's where there are resources. Are there, I think the last piece I want to ask is around if there are any specific recommendations that you have for journalists in the Caribbean on any of these topics.
As a journalist in any developing country, not just the Caribbean, you're very frequently dealing with limited infrastructure around creating solutions. Most of the time, developing countries are struggling with meeting the very basic needs of their populations. And topics like mental health don't get dealt with at all because leaders just don't have the bandwidth. You're dealing with basic things like sanitation and social welfare, and young people, for example, who are at risk completely get overlooked. So you find a lack of organized bodies and infrastructure that have data, and also not just data from a quantitative perspective, but even from a qualitative perspective. Like, this is what we're dealing with. So I would suggest to journalists in the Caribbean or any developing country context that you have to have the patience and the passion and the perseverance to dig and to reach out to people and not to be scared and to have courage. And whenever you're reaching out to young people, to always ask the permission of their parents. And when you're doing that, also, you have to be really careful not to exploit the very people whose problems that you are trying to solve, because there's, as a journalist, a very fine line there where oftentimes you get more traction to a story when you quote unquote exploit that story, when you have the sensationalistic headline, or when you reveal details that could actually violate somebody's privacy. And in many contexts, there's no legal infrastructure that protects those people. So you have to ask yourself, where do I draw the line in getting this story across so that I don't hurt the person whose story I'm telling. In the US, there's a legal infrastructure there that helps people if their stories are exploited. In the Caribbean, not so much. Yes, there is some degree depending on which country you're on, but people are not as protected. And I don't know, you'll have to edit that section right there because I don't want to make anybody angry at me by saying that. But I always have to be really careful because I don't want to hurt people in telling their story while still wanting to help those on a larger scale. And I mean, obviously, it brings up so many issues around integrity as a journalist and um, vulnerable communities and how to be responsible about telling their stories, especially in contexts where you're lacking in data. It's as one person, it's impossible to pull aggregate numbers around a problem that has been largely unexplored within a specific community. What I often do is I create, obviously, you're going to drive that story through um, first person narratives, but also what you have to do then is draw examples from similar global contexts. So, for example, for me, in the case of mental health piece, we don't have a lot of formal data around mental health issues within the region. So, oftentimes, what I'll say is within the US, X amount of children have contemplated suicide, for example. And I can say a lot of these same problems exist within the region, just to provide some degree of context. But when you don't have data, you don't have data. And as an individual, there's just so much you can do if you want to put out a story right there and then.
So providing whatever data does exist and contextualizing it as best as you can in your particular ecosystem.
Absolutely, with first person narratives in a very responsible way. Sometimes, actually, what I like to do in terms of sensitive information is allow the subject to read the story first and make sure that they're comfortable with it before I publish it.